High ankle sprains, a common injury in the athletic population. But how are they diagnosed, and what's the best way to treat them? High ankle sprains are common in contact sports. So football, basketball, soccer, and hockey are some of the sports that high ankle sprains are a little bit more common in. What ends up happening is the ankle is flexed to dorsiflexion and external rotation. So essentially what happens is the ankle flexes up and rotates out. And this causes an injury to the ligaments that connect the tibia and the fibula bone, so the two bones that make up the lower leg. So the ligaments that are involved with a high ankle sprain are kind of a mouthful, but on the front side of the tibiofibular joint, we have the anterior inferior tibiofibular ligament, and then on the back side of that joint, we have the posterior inferior tibiofibular ligament. And in between, we have the interosseous membrane, which connects the tibia and the fibula bones. Usually it's the anterior inferior tibiofibular ligament that is injured with a high ankle sprain, but depending on the severity, any of the ligaments can be involved. The diagnosis of a high ankle sprain is generally made with a good history and a physical exam. In the history, there's generally a history of trauma, and so generally it's someone whose ankle has been forced into dorsiflexion and external rotation. And then for the physical exam, when we bring that ankle into dorsiflexion and external rotation, there's pain in the tibiofibular joint. There's a couple concerns we have when someone suffers a high ankle sprain. So one of them is that the tibiofibular joint is a very stable joint, and so we're concerned about a fracture to either the tibia bone or the fibula bone. There's also a concern of instability in the joint. Since it's such a strong joint, it takes a lot of force to stretch out or damage those ligaments. So there might be instability in that joint after a high ankle sprain. An x-ray can be used to assess whether there's a fracture. So mainly we're looking at the tibia, the fibula, and also the talus bones. And then we can also get an MRI, which will actually show the damage suffered to the actual ligaments around the tibiofibular joint. If there's no fracture or instability in the joint, then we can treat most of the high ankle sprains conservatively without any surgery. In the beginning, it's recommended that the ankle is immobilized for typically 3 to 5 days to allow some of the swelling to decrease and also to allow some of the tissues to start healing on their own. As far as rehab goes, we want to strengthen the muscles that are going to help control dorsiflexion and lateral rotation of the ankle. The muscles that control dorsiflexion are actually the calf muscles, so we'll mainly be focusing on strengthening the gastrocnemius and the soleus muscles. Generally, this will be some sort of heel raise, so we can start off by doing a double leg heel raise, then a single leg heel raise, and then adding weight as tolerated. The muscles that control external rotation of the ankle are the posterior tibialis muscle, the anterior tibialis muscle, and also the flexor hallucis and flexor digitorum muscles. Exercises that we can use to strengthen these muscles would be just like a resisted external rotation, so we'd actually be trying to internally rotate our ankle against the band. I like to progress the exercises into some crawling variations where the feet will actually be externally rotated, so that way they actually have to strengthen the internal rotators of the ankles during a weight-bearing position. The recovery time for a high ankle sprain is a lot longer than the more common inversion ankle sprain. Typically for an inversion ankle sprain, the recovery time could be somewhere between 6 to 8 weeks, where for a high ankle sprain, we could be looking upwards to 12 weeks. Thank you for watching this episode on high ankle sprains. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up, and if you want to see more of my content, go ahead and hit that subscribe button, which I think is over on this side, but it might be the red button on this side. Wherever that subscribe button is, go ahead and press that button.